Hi, I'm Hugh Robertson, and I deal with health and safety issues at the TUC. This is the third webinar I've done. The first two were on stress and then occupational cancers. Now, you can participate as well. You can ask questions, you can answer polls, you can comment. If you want to participate in the webinar, you can ask questions in the box below, and you can also comment and chat to other people in the live chat just by typing something in the say something nice box at the bottom right. Let's start, shall we? Well-being is an important issue for the TUC. It's also part of our Great Jobs agenda, which is a campaign that we'll be running over the coming year. I think first thing what is well-being? Because union representatives, union members are being confronted with it as more and more employers introduce well-being programs at work. But what actually does well-being actually mean? I mean, there's a quote from the Oxford English Dictionary, which is the state of being comfortable, happy, or healthy. And, you know, well, with that, it's a good thing. And we all want it for ourselves and for others. The government's now started even measuring it as well. You can go on the NHS website, you can measure your own well-being. And usually it's seen as being the same as wellness or an absence of physical or mental illness. But also, I'm not trying to be cynical here, but it's also become quite a bit of a marketing tool where you're most likely to see well-being and wellness is actually, you know, in your local supermarket or department store or sort of Butcher Superdrug or whatever. And here are a few of my favorites just before we get started. You know, you can get well-being shampoo. But I'm sure it's all wonderful stuff. Or Twining makes well-being tea bags. One of them appropriately called Mint Humbug. Then, of course, who can do without wellness cat food? If you go onto Amazon, you can get 24 packs of that for £108.59 plus £37.58 postage. Well, my local supermarket's got 24 pouches of Whiskas for £6, so I know what my cat's getting. Wellness is a whole range of cakes and biscuits that is done abroad. You know, this is Jaffa cakes, but this is my all-time favorite, I'm afraid, the last one, and that's Wellbeing paint from Dulux. I found this in a local hardware store, and it's even trademarked the name Wellbeing. So, you know, I'm sure that you'll find Wellbeing paint brushes out there as well for it. But let's get into well-being in the workplace, because that's really what we're here to talk about, isn't it? In the United States, companies are estimated to spend $6 billion a year on wellness or well-being programs. And 70% of the top 200 companies, half of all companies with over 50 staff in the United States have got some kind of well-being or wellness program. And you know, that can be great, but also it can be a bit dodgy at times. If you look at what's happening in the United States, for instance, in Chicago, the teachers have to pay an additional $600 if they don't participate in a set number of well-being activities every month on their health insurance. So health insurance provided, but if they don't actually do the well-being activities, they've got to pay a bit more. And also, you know, a lot of these well-being programs in the United States are sometimes linked to promoting things like substance-free lifestyles, or even worse in some cases. Now, that really isn't happening to the same extent in the United States, as in the UK as it is in the United States. But still, you know, I have seen quite a few companies in the UK introduce contracts where staff are being offered private health care insurance, so on, but linked to you know, certain well-being programs and so on. Often, really, what we're seeing in the UK is wellness or well-being programs, just general programs around health checks, smoking cessation, exercise, but more often stress management. And that's really what you're most likely to come up with in your workplace. So is it a good or a bad thing? Well, it's really both. Most well-being programs, as I said, are really being introduced because of stress. And stress is responsible for well over a third of work-related sickness absence and affects over 500,000 workers. It's also closely linked to musculoskeletal disorders. If you've got a problem with stress, you're more likely to also have problems with back pain, etc. It's also very close. There's clear evidence, however, that what we can do with stress is we can get rid of it, or at least reduce it. And there's clear ways of doing it. It's called the stress management standards. But over the last few years, far less employers are actually using them, despite the fact that they work. In part, that's because the HSC have actually stopped promoting them, despite the fact it's their management standards. And also because there's this gap, and a lot of consultants have decided they're going to sort of try to fill it, and they're now going and they're trying to market their own programs about stress, and it's almost all well-being. And it can be a range of initiatives you might have seen, awareness training on stress, coping strategies such as cognitive behavioral therapy and mindfulness. More recently, stuff like resilience training is very popular. Of course, the old usuals like on-site massage, reflexology, and whatever. Now, some of these, in particular cognitive behavioral therapy and mindfulness, they can be used in supporting people who've got a stress-related illness. But what there is no evidence of is they can actually help prevent illness in otherwise healthy people who are put under stress. The other thing is that these programs, what they do is they concentrate on the worker, not the workplace. But the problem with work-related stress is the workplace. It's how hard you're having to work, how little control you've got, and so on. So the best way of dealing with it isn't to look at the individual worker, but to get rid of these causes of stress. But all these other initiatives, well-being ones, and sort of coping strategies, they're much easier and cheaper for the employer than prevention, which is why we often see that. That said, the workplace is a useful way of promoting good health, and people have been doing that for decades. And the best way of improving good health is by changing the way work is organized. In actual fact, giving people more free time, for instance, having proper work-life balance, flexible working. Good pay is actually one of the most important things you could do to improve well-being. But what we see instead is much more emphasis on the individual. The individual can change their lifestyle. They can exercise more. Well, the reality is, if you're working, in some industrial estate out in the middle of nowhere in a call center without any access to decent food, apart from perhaps, sort of a local takeaway, then, telling people to exercise more ain't going to eat better isn't going to help. Also, if you've got a lot of long hours, domestic responsibilities, and so on, just saying, yeah, get out to the gym, it's not really going to work, is it? Not be negative about all of these. I think that well-being initiatives can have their place, and they can be very useful, because work is responsible for a lot of ill health. If you think of things like diabetes, for instance, that can be a result of your diet, but it can also be because you're sitting down all day, not getting any exercise. You could be a driver or whatever. Likewise, stress can cause not just sort of depression, anxiety, but also can help lead to cardiovascular problems. The stuff that's in the air around you, particularly if you're in construction or something, can be responsible for a lot of lung disorders. So there is a big link between work and health, and we can actually do stuff about it. And also, our members, they actually like a lot of these well-being initiatives for good reasons. They like it when employers actually notice for what they're doing and sort of say, well, we're giving you things, we're offering you things, and we should be involved in that, but not without any kind of illusions, not just jump in and say whatever the employer actually says we're going to support and get involved in. These well-being initiatives have to be in addition to prevention, not an alternative to it, but an addition. It has to be stopping work making you ill in the first place. And let's do that first. But also, a lot of unions have actually used some of these as recruitment tools. They've organised, well-being, wellness, in their workplace. They've worked with the employer about making sure that union members can actually get access to some activities. They negotiated discounts for local gyms and so on. There are a lot of things that unions can actually that are quite useful and helpful in well-being. And I'll be coming back to some of these in a minute, but let's never forget that if the workplace is making people ill, the best solution is to change the workplace. It's got to be the top priority. So some of the good stuff, well, here's a few that I've listed, and there's little here that we wouldn't welcome. Exercise classes at lunchtime, for instance, if people have got time, as I said, access to a gym, cycling to work, providing discounts on or subsidised cycles, for instance. There was a government scheme for a number of years. I don't know if it's still going on. Discount on buying a bike. If you're doing things like access to a gym, cycling, sort of yoga at work, I'd also recommend trying to get provision of showers as well in the workplace. That's probably the two go together. Sponsorship of sports and social activities is another thing which you can do, or your employer can do, to try to encourage people to be active. Healthy eating, and that's, it doesn't mean if your employers are already providing some kind of lunch, which a few still are, that they're going to suddenly sort of take everything away and replace it just with sort of a salad bar, because you probably have a riot in your hands if that happens. It's a question of making other things available as well, encouraging healthy eating. Things like smoking cessation programs. You can subsidize nicotine replacements, for instance. These are examples. And one thing that I think is often very good is employee assistance programs, and they can be really, really useful if they're done properly. A lot of employers introduce them, make sure that you're involved where they are as a union. But some of these can also have downsides, some of these. For instance, some of the issues like Weight Watchers or other schemes, not Weight Watchers in particular, which often come in at lunchtime and try to encourage people. It's great, but often they target the wrong people. The kind of people who go in these programs are often people who are actually a little bit above the average body mass index, but often people who are heavier feel pressurized by these. And the other thing is that when they've been attempted in the workplace, they do often work for a few months, but if you go back and look about a year or 2 years later, often there's very little difference, sadly. There's a couple of employers who have actually properly analysed the responses to trying to get work around weight. That's not to say you shouldn't try them. Likewise, against sports and social events, often are very unimaginable, often just five-a-side football or snooker. Usually it's more likely to attract male men than women, and often it's around alcohol, a lot of these social events. I'm not against that, but what I'm saying is sometimes it's just a sort of well-being initiative. What we find in some cases, again, is that if you have got to deal with your employer for reduce gym membership, or for certain forms of access to certain therapies and so on, such as to physio for free and so on, it can come back and bite you because one, there can be a cost to you. Often it's a hidden one because sometimes these deals are only for a set period of time, or there are implications in some cases. So be careful, what you're signing up for. And the other thing that's very common is that they're available to only some workers. How many well-being programs are aimed at groups like the cleaners, for instance, or the catering staff, or the porters, or whoever. They're more likely to be targeted at middle or higher grade workers. The other thing is that some of them are just, how can I put this politely, that they're effective. There are some things which are great and people like, ranging from reflexology and whatever, and great if people want to do that. But the reality is it doesn't actually necessarily mean that unless you actually believe they are going to work, that they will have much effect. That said, if people want to do it and employers are going to pay for it, fair enough. Why should we be stopping people do things like homeopathy but it's not necessarily going to make a major difference in the workplace, especially if people don't feel comfortable with them. The other thing is that employers often use well-being as a way of actually preventing unions doing their job, because what we're getting a lot is employers are appointing what they call well-being ambassadors, right, or well-being committees. Now you think, oh, well, the reality is they're often dealing with areas in particular around stress, which should be being dealt with by the Health and Safety Committee and by the Health and Safety representatives. And remember, you're the people who have a say. The union members are the ones who have the say in the safety reps. You decide who your safety rep is going to be. Often, ambassadors are actually appointed by the employer, not always. So what we find is that they cut across the union role. That reps are going to the Health and Safety Committee and saying, stress, and they say, oh, that's all dealt with. It's been dealt with by the Wellbeing Committee. They're doing this, that, and the other. In actual fact, stress is a workplace issue, it's a workplace hazard, and it must be seen as a health and safety issue. That means that reps have to be involved. But that said, what we can also do is run our own well-being campaigns. You'll find quite a lot of suggestions there's a TUC guide to work and well-being, and you'll find it on the web under, just put work and well-being TUC, and you'll find it there. And there's a lot of really good stuff around what unions can actually do, well-being, rather than just what employers can do as well. But when we do them, I think we've also got to make sure we're linking them with prevention. So if we're doing stuff around, encouraging people to do something about stress, we're making sure the employer is doing something about reducing stress. And we also try to recruit on the basis of it. Now, just want to conclude really to say what I want to, hopefully, to get out of this. Because I haven't gone into a lot of detail about what the well-being is, because for us, well-being isn't really just something that's about sort of, nice hands-on stuff. Basically, for us, well-being is best done by preventing illness, by having good respect for people at work, and that's a very important one, giving people security at work, and giving them. That is actually what would lead to well-being far more than any of these initiatives the employers are doing. If you ask your members whether they want on-site massage or whether they want sort of respected well at work, control over their work, and have decent pay, I'm pretty sure which side they would actually go down on. That said, well-being can be a useful thing in the workplace. And to give one example, in our northern region, done some fantastically good stuff in going in to employers with good packages that actually work, that are based on both supporting members and also prevention. And it's made a fantastic difference there. So do use the guide to see what you can do, because if not, employers will just come up with their own things. And if it means supporting employers' different initiatives, and if they make a difference, then of course we should. Let's get involved in them. If your employer is saying we want to do something about smoking, we want to do something, I'm going to be to say yes, it's great. But remember to always look at, is there something involved with the workplace these things as well? Is it a problem with stress, or just the fact people are sitting down all day and don't have access to good food? If it is, then you've got to address these as well. And then that can be, that for your members. And finally, often, well-being is introduced through companies. You can have one single provider, and where that happens, then often they use it as a way of getting in to the workplace, and they'll say, we are going to offer all these things as part of a well-being package, so discounts and that, discounts and this, or even in some cases, free access to dental care and certain health checks and so on. But there are certain other levels which you have to pay, and sometimes when you go and try to get your free package, you find there's a hard sell to try to get various screening done and so on. So be wary of that. Often these packages, even the health screening, it can be an attempt just to sort of drag people in and then sort of charge them a lot of money, and you don't want to be signing up to that for your members. So check it out beforehand. Find out if they are an accredited provider, for instance, and also whether or not actually doing everything for free rather than actually trying to sell a bit more, and also find out whether or not all these packages aren't also available through the NHS, which a lot of them actually are, just by going to your doctor to get a lot of these, and at least that way you'll also get the treatment if there are any issues. So that's it from me at the moment. What I'm going to do is take a few questions, and I see there's actually quite a few of them. So here we are. Hi, we have Andy. Hello, Andy. We have wellbeing champions in my workplace, and now they're all being asked to train as mental health first aiders. This worries me because people with mental health issues are going to end up treated by very underqualified people. What's your take on this, Hugh? That's a slightly difficult one, because the issue is whether or not people who actually signed up to be wellbeing champions also wanted to be first aiders, because they're very different roles. Mental health first aid, there is some evidence that it can make a difference in the workplace, and sort of Union Learn actually provides some training on some aspects of mental health first aid. And it's a bit like, sort of any other kind of first aid, basically. You've got to know your limitations. And the problem with it is that when people have got mental health issues in the workplace, the level of support that's available for them through the NHS is nowadays very, very little, and often through the employer, very, very little. So what employers are now is introduce these kind of mental health first aiders as a way of accessing support on the cheap. Now, that said, where these people are there to raise awareness and to support people in getting need, rather than being seen as being some kind of sort of little second-class therapist type thing, as some employers seem to envisage it, then it can be very useful, because people who do have mental health issues in the workplace do need support. They often need signposting, and sometimes they need a voice to actually help them to management, or just to tell them what kind of support they can get elsewhere. And mental health first aiders, that is effectively what they should be doing. And if that's what they're doing, then great. We've got absolutely no problem with it. But if employers see it as a bit more than that, then I think what we've got to do, and I think your question's a really helpful one, then what I will do is we'll perhaps do a blog or on that about how we can actually support those people who are wanting to become mental health first aiders, but also making sure that employers don't take advantage of them, because it's certainly not something we want to undermine. We want to make sure that who do, for very good reasons, want to support their colleagues in the workplace have the opportunity of doing it. Now, let's see. We have regular health checks at work. What do you think the benefits of them are? Well, I've really mentioned that, I think, just at the end. And you obviously asked that before I got to that, so apologies for that. And, as I said, anyone over about 50 can get a similar service from the NHS. Just make sure they're not trying to sell other services. And one of the most common one is for men, PSA testing for the prostate, for instance, which they often charge for, which is of limited use. And also make sure that the union is involved in the scheme to make sure it's comprehensive. Another issue is confidentiality. For instance, let's say you've got someone coming in to do health checks, and they find out that if a worker is found to have a condition that could make them a danger to their colleagues or the public, what's the provider going to do about it? Are they going to tell the employer? They shouldn't direct. On the other hand, if they don't do something about it, this person could actually be a danger to your fellow workers. So there has to be a system of trying to ensure that this person is supported, encouraging in being open about their condition. And often the providers aren't very good at that. So these are the kind of things the union should be involved in early on. So what other ones have we got? Again, here's another one. We've already seen that you mentioned about wellness programs. We've got a scheme that allows us access to some basic free healthcare like dental care and physios, but the company that provides it is always trying to get us to pay more for additional treatment. Yeah, thanks. I've seen a few of them. So again, don't sign up basically once you're seeing an occupational health provider without actually shopping around, because often you can get the thing for free through the NHS or cheaper through other private providers. Here's another one. ACAS put me on a course about being a mindful employer, about being a mindful employer and promoting resilience training. What can you do to get them to promote stress management successfully? Quite. Thank you, Joyce. I really appreciate that. Resilience has been pain of my life for about 3 or 4 years. If you go to Hazards magazine, you'll find an article that I wrote, I think it was 2004, resilience, before it was quite as big. And there's very little evidence that resilience can have any benefit in preventing people who have got actually developing stress-related conditions. There may be some benefit for people who've actually got an illness as a result of stress. But what we should be doing is, as you quite rightly say, trying to get them to use the stress management standards more successfully to prevent it. We're doing a lot of work with the Health and Safety Executive on this. On our web guide on the stress management standards that we've done jointly between the TUC and the Health and Safety Executive. They're doing some pilots in education with us at the moment, and hopefully we'll be hearing a lot more about this from the HSE. But, to be quite honest, until they actually start prosecuting people for not using them and for wrecking their employees, then, I don't think they'll be as used as they should be. Now, I see we've now reached the cutoff time, 3 o'clock. It went really quickly, and thanks to all of you for tuning in. This will be So on YouTube and the TUC website. The next one we've got is, I've completely forgotten what it's about. It's about young workers, thank you, next week. And hopefully I'll be doing some more on health and safety, health issues in the future. So I'll be going through the questions you've been asking as well, and hopefully I'll be able to sort of make sure that these issues are raised in the kind of materials that we produce. Thank you very much.